Nursing homes here in New York are now set to receive almost $400 million in emergency government COVID-19 money. That cash is greatly needed, as many leaders claim that these adult care facilities have become death traps in many cases. And tonight, there are calls now for more staffing statewide. Here's our I-Team Chief Investigator, Charlie Specht.
It's hard to put the emotions into words. My heart just aches.
Alice Marszewski's mother spent a year at Orchard Rehab and Nursing Center in Medina. Her daughter says the staff did their best, but there never seemed to be enough nurses to care for residents like Irma Pagan-Williams.
It always seemed like there weren't enough hands. They seemed to be always running.
Her mom's favorite RN ended up leaving. She was able to put a number on what seemed like chronic understaffing.
She said even with the aides that she had, you had one RM per 62 residents. She was in tears.
COVID-19 has exposed problems of nursing homes in New York State, but some state legislators say it doesn't have to be that way. They're pushing the Cuomo administration to reverse its opposition to a safe staffing bill that is currently stalled in Albany. Like Assemblymember Sean Ryan of Buffalo, Assemblymember Richard Gottfried of Manhattan has advocated loudly for nursing home reform.
Back a year ago, when we were doing the state budget, a lot of us were trying to get a safe staffing requirement bill enacted. The executive branch strongly opposed it, and they agreed instead they would have a working group that would look at the situation, and in December, meaning 5 months ago, they would come out with a report. Well, the report has never seen the light of day. I don't know if it ever will.
A spokesman for the state health department said the staffing study, now 5 months past due, quote, remains under review. Unlike other states, New York currently has no minimum requirement for staffing in nursing homes. And it's no accident that proposed reforms haven't made it to the finish line.
Up until the pandemic, there was massive moneyed interests fighting against staffing ratios.
Stephen Hansa of the New York State Health Facilities Association represents 450 nursing homes in the state. He says operators already have a hard time filling nursing jobs.
If the bill was implemented as written, there are not enough nurses in the state of New York to meet the mandate, period.
He says New York would need to increase its Medicaid reimbursement to nursing homes to make any such reform financially feasible for nursing home owners.
Legislation needs to be operational, needs to be practical.
Alice Marszewski says there's no excuse for the rodent droppings and filthy pads she found near her mother's bed. Her mother fell out of that bed in January and died a week later. With safe staffing ratios, her daughter says it all could have been different.
She definitely would have been a whole different person, and I think she'd still be with us today.
A spokesman for Orchard Rehab said he couldn't comment specifically about this case, but that he would look into it. The governor's office did not respond to our request for comment, but Ryan says he plans to take this up and push for passage of this bill as the legislature gets back into session. For the I-Team, Charlie Specht, 7 Eyewitness News.